resource session on accessibility and ADA compliance. The session is going to be led today by Michelle Boldman, and I will turn it over to her now.
Hello. So I'm Michelle Boldman, and I'm the Accessibility Services Coordinator here at Shawnee State. And I'm located at Hatcher Hall, which is also the same location where Counseling Services is located. It also used to be the place where we had the clinic. If you ever had to come and receive any kind of care there through the clinic, we're all in the same building. So I'll just get started. I'm going to start off with just some basic information about ADA, which is the Americans with Disability Act. So it's a law that protects individuals with a disability. And there are several different areas that this covers. There are several different sections of the law that it will cover. But basically, for us as a university, this law includes that we have to follow this law because we are a federally funded entity. So we are responsible for making sure that we provide an accommodation. It's up to the student to actually utilize the accommodation. So as long as we are offering that accommodation, then we are following those guidelines. And let me see here. I do have mentioned on here, like the law does state that we are responsible for providing those accommodations within reason. Like it has to be a reasonable accommodation, which means that once the accommodation would be considered unreasonable, then that accommodation would not need to be offered. So once that accommodation would, question the integrity of the program, the material, or the education that the individual would be receiving, then we would have to look at that accommodation and make changes to it so that we're kind of on the other side of it. Of course, we don't want to give an accommodation to a student that it's going to actually hurt their education more than help them. And I will go into that a little bit more here in just a minute. So the ADA does not have like a defined list of disabilities that a person would fall under. And there's a couple of reasons for that. The main reason being is that, the way I respond or react to a certain condition or a disability could be extremely different for somebody else. And the way I react to it could cause me to have some major life changes, and for others it may not. So while we are given, examples of disabilities or diagnosis, there's not like a defined list. So I did list a couple disorders on the slide here, and I'll just kind of go through them really quick. So for a physical disorder, you have your visual and hearing impairments, any kind of traumatic brain injury, which could be caused from a stroke, a head injury, including like a concussion or contusion, mobility impairments. So that could be like paralysis, amputations, a spinal cord injury, arthritis and joint disorders, including like RA, fibromyalgia, and then autoimmune disorders. So MS, lupus, IBD, Crohn's disease, diabetes, cancer. So with cancer, that includes active or in remission. For a mental or psychological disorder, this one is one that I see a lot of across the board with young adults and older adults. Would be anxiety disorders, generalized anxiety disorders, including like panic disorders, social anxiety, mood disorders such as depression, bipolar, and then you have neurodevelopment disorders. So that's your autism spectrum disorders, ADHD, ADD, like special learning disabilities such as dyslexia, Tourette syndrome. Then you have intellectual disabilities, and you have communication disorders, and then post-traumatic stress disorder. So it's a transition from high school to college. So this is something that I see a lot of. Students really struggle with this as far as accommodations go, and that it can really create a lot of barriers for students because depending on how they received accommodations in high school will really play a factor into that transition, as to how easy or how hard it is for them. So in high school, typically a student, they'll have an IEP or a 504 plan. They may have an aide with them all day in class. That aide will follow them around. The aide will sit with them. The aide might make notes for them. Will offer constant reminders. And obviously, when they come to college, they don't have that. And that can be a bit of adjustment because there's a lack of accountability there. Um, and that for some students is very difficult to learn. And so they will, be in class and they just won't do something, not because they're being lazy or because they don't want to. It might just be a total lack of awareness, because they've been so used to having someone say, hey, you need to do this, or hey, here, a reminder, you got to do this by tomorrow. So that a lot, I see that a lot. And then it also depends on the type of accommodations that they had in high school. And I will talk a little more about this here in a minute, but accommodations are somewhat different on the higher education level compared to high school. And that in itself is also a bit of a transition for students, but it can be more of a barrier, because if a student received, for example, like a 50% reduced coursework as an accommodation in high school, when they come to college, they don't have that accommodation. Like they're going to be responsible for doing the same amount of work as their peers. And the final thing that really is the bigger concern with the transition period from high school to college is just the fact that they're now an adult and they are responsible for utilizing their accommodation. So as I mentioned before, we're responsible for establishing those accommodations and providing them, but it's up to the student to actually utilize it. So an example of that would be if they have a testing accommodation. Well, in high school, they would have somebody either come get them and pull them from class to take that exam, or they would, go off to a different classroom with a group of kids that might also be taking the test with accommodations. It's going to be up to the student here, like on the higher education level. So they're going to have to initiate that process. They are going to have to go to the professor, work out a plan, whether that's taking the test after the class is over, during the class in another area, or scheduling to take the test with me here at Hatcher Hall. But they have to be the one to do it. And then if they do take it outside of the classroom, so for example, if they take it here, there's a process that they have to do to ensure that that is followed to make sure that they can take it over here. And I'll go into that a little more too. But those are just some of the barriers. Now, I will say, since I've been doing this position, every semester, my numbers are climbing. I mean, just climbing. And it's not just like one or two. It's typically, oh goodness, in fall especially, I would have at least 10 to 15 new students. Right now, I have a total, like on my caseload for academic accommodations, I think I have 130. And fall, I had 156, I believe. And the difference between fall and spring, the numbers always drop a little bit. And I think that's more of a students come in the fall because that's what they think they want to do. They go through fall semester and then it's like, oh, that's not for me. I don't want to go back. And then there are some that just struggle so much that they fail out and they don't want to come back or they can't. So I'm going to explain the process of how how a student would apply for accommodations on campus. So again, it's up to the student to initiate the process. Now, there is a big misunderstanding that students seem to have is that when they graduate and they tell the school, yep, I'm going to Shawnee State, that they are going to like send me their accommodations and it's just automatic. And so students think that, oh, I'm going to college, I don't have to do anything. Again, it's kind of like that, just that mentality that they had while they were in high school, that it was kind of all done for them. But that's not the case. So if a student has ever been, or if a student has ever received an IEP or a 504 plan in high school, they have to contact our office. That information, there's not like a database that would tell me, alert me, hey, this student's coming to Shawnee and they have an IEP. That's not how that works. And I tell students, and I'm like, you need to think of it like this. When you graduate, technically your IEP and 504 graduate with you. And yes, you can receive accommodations in college at the higher education level, and you can receive accommodations in the workplace, but you have to initiate that process. So they would just need to reach out to me, either through email, they can call me, they can stop by the office. On our website, there's a place where they can fill out the form and it will actually send it to me. But side note, I don't know how trustworthy that is. And I say that just because I've had a couple students say they filled it out and then we never received them. So I don't know if it's a technical issue or if it's the student just didn't really do it. So I don't know. I would rather just have like actual communication with the student, like one-on-one, just so we can work out a plan to meet with one another and I can get them the application. So they would reach out to me. They complete an application that I would send to them. If they struggle with technology, if they are too overwhelmed and it's just too much for them, I can sit down with them and complete the application with them. That's not a big deal. It doesn't take very long. Now, to be approved for accommodations, they do have to provide documentation with proof of a diagnosis. And proof of a diagnosis, we can use an IEP or a 504 plan that's less than 3 years old. So if it's 3 years old, if it's 3 years or older, they would have to have something from a provider that is currently providing them care for the diagnosis. But the provider, if they're going the route of using a document from a provider, they can email that to me, they can fax it to me. If they want to provide it to the student picks it up from their office, the student can bring it with them when we meet, because the next step would be to meet with me and we sit down, we go over, the application they filled out. I go over the paperwork that was sent to me, whether that was the IEP or the 504 plan, or if it was the document from the provider. And then we look at accommodations and where they struggle the most and see what would really help, or benefit them the most in the classroom. And then from there, they're only, as far as with my office, their only real responsibility is to complete the renewal form at the end of each semester. So what I do is about 2 weeks before the semester ends, I send out a link and the student just clicks on the link and they like fill in the information and answer a couple questions and click submit. Super easy, very generic, takes less than like, I don't know, 3 minutes. And that will renew their plan for the next semester. And so what I will do is I will write up a new letter that'll have the new dates and everything on it. And then I send those letters to the professors that they are registered for that semester. So that way the professor is receiving that document from me and it's not just coming from a random student. Because I know I think before me, there was an issue where I believe a student had, I don't want to say they stole it, but they had access to someone else's accommodation letter and it was doctored a little bit. And so they tried to, pass that off as their own. And I mean, if you would look at it, you may not know that. but because that came from the student at the time, that's how things were, I believe that's how things were done. And so there was no reason to really question it. So that's why to expect the letter from me. That way we just know that the authenticity of it. One of the things that I do when I meet with students, I go over all the additional resources that are on campus. We talk about the Success Center. We talk about the Peer Drop-In Center. We talk about different groups that are available to them. I make sure that they can, if they have their cell phone with them, this is something new that I started doing. I think it wasn't fall semester, it was last spring. They have their phone with them. I have them pull their phone out and I have them show me that they can log into their email and that they have like remote or not remote, but have like digital access to their email from their phone. And I do that because that was one of the biggest complaints I had from students was, I'd be like, I've been trying to email you or I've sent you this document, and they say, well, I don't have access to my email. So I do sit with them, make sure that they can access it, make sure they understand that, like how to view their emails and all that. And then I will also have them pull up Blackboard or my SSU app, just any of those digital tools that they might need. I have them pull those up and we kind of go through those a little bit. We go through, different scenarios of different circumstances or different situations that they might face based off of their history. If they have experience, dealing with people like bullying them because of their disability, or if they were, if they felt like they were, just thought of differently or degraded by teachers or someone in the past. We've talked about ways to deal with that. And I also explained to them, college is quite different than high school. In high school, everyone has to be there regardless if they want to be there or not. So a lot of times kids will find things to entertain them, and that usually includes like poking fun at other people. And I said, in college, you're here because you want to be here. Like, you're all paying money to be here. And so no one really cares how you get your education because everybody's worried about getting their own. And so that seems to help a little bit. I don't hear a lot of concerns being brought to me anyways, as far as, issues with other students or issues with student or with professors. I think the biggest complaint I've had with professors is they email them and they don't hear back from them. And I just tell them, I'm like, you have to give them some time. Think of how many students they have. Think of all the classes they teach. Because I think for a lot of students, it's, well, I emailed them today, 5 minutes before they walked in to see me. And I'm like, they're probably in class. How about you give them a couple hours? But I can be like that middleman person, so to speak, for a student if they are, struggling communicating with a professor. I can reach out to the professor. And sometimes it's just a misunderstanding. It might be something where the professor is like, oh, well, I mentioned it to them in class as they were leaving. I didn't think that there was anything else that needed to be addressed in the email or, whatever. But I really haven't had any issues as far as students having complaints from professors giving them a hard time because of their disability or because of their accommodations. Let's see. Okay, so I'm going to discuss a little bit about the accommodations, some common accommodations that professors may see that I tend to see a lot of. That's the extended time on tests and quizzes up to double, a distraction-free testing environment, preferential seating. Now, I know that typically, in higher education, professors aren't assigning seats. Now, they might be assigned certain places like during labs or something, but as far as like classrooms go, it's usually like first, second day of class, kids are all coming in, they sit down, that's where they end up sitting the whole semester. But for, for example, if the student has extreme anxiety and they have the accommodation breaks as needed, which was the next one on the list, for them, it might be easier for them to be able to pick sitting by the door, so that way they can just kind of step out and take that minute breather, or just take that couple minutes they need to just kind of vibe out, to clear their head, to come back in the classroom without disrupting the whole class. So they're not having to get up and walk in front of the whole class every time they have to step out. So those usually kind of go hand in hand. It is explained to students the breaks as needed does not mean that they can leave class and go to McDonald's and get breakfast. They can't go to Starbucks to get a coffee and then come back to class. But the breaks as needed is specifically a break. Like, we're taking a break, not a vacation. So, and most of them, I mean, I haven't had any complaints. I've had the one complaint about the kid that, I mean, he left and went and got McDonald's and tried to come back to class. But other than that, and that was like 2 years ago. So other than that, I haven't had any complaints about that being an issue. I did have one situation where the breaks was becoming very excessive. It was a lot, to the point where it was questionable, like, okay, are they even learning anything because they're out more than they're in the class? And that was just specifically due to the individual's disability at that time. There was a flare up that was happening, and it was something that was not normal for that individual. So the next one on the list, this is a new one. So use of a digital recording device for note-taking purposes. So in the past, pre-COVID, we used to have note takers. And so people that were like specifically assigned to sit in classes and take notes, and then those notes were copied and given to the student. Then COVID happened, and that we did away with that. So now, and I've actually have found that students actually prefer this, the use of the digital device. This means like a digital audio recording. This is not like you can't turn your video on and video someone. This is just an audio recording. But students prefer the digital recording because they can play it back at their own pace, and they can make their own notes, which I also think is more helpful than just reading someone else's notes. Because I know if I make notes for a class for someone else, they're not going to understand them. Like, how I make notes is not how somebody else is going to make notes. Like, I make them in the way that I'm going to remember things or learn things. So that has really been beneficial for a lot of students. The next one is the use of a calculator as needed. Now, of course, if it is an exam, and it's specifically geared towards like making sure that the students are aware, or they need to show that they know how to do a process, and using a calculator would cheat that, so to speak, then they wouldn't use a calculator for that exam. And then digital versions of textbooks. That's also another big one that I see a lot of. And I have a platform through Bookshare that we have a subscription to, and I can, if they don't have the book, I can send them the information of the book, and they will get it and then convert it to a digital version. Or if they need, like, if we need like a certain audio, like if someone is has a vision impairment and they use like a screen reader, then you want to have, you know, a particular type of digital version that's going to be easier for a screen reader to pick up on. So special accommodations, and this really depends on the individual's diagnosis or disability, and the extended time on homework and classwork. So this one is a very, very common one for students in high school. And again, this kind of goes back to that transition from high school to college, because this is not a typical accommodation that is offered. And the main reason for that is, if you remember me mentioning how accommodations need to be reasonable. So if you think of high school, you have the same schedule every day. You're going to have English Monday, Tuesday, Wednesday, Thursday, Friday. While college, you typically have classes. Typically, you have classes on like Monday and Wednesday, and then a different class or a lab on like Tuesday and Thursday. So if someone were to be given extended time on that homework, so if you have a class on Monday and that assignment is going to be due on Wednesday, but you have an accommodation for like just say one day, well, now that homework is not going to be due until the next Monday. And so they're going to constantly be behind in that class. And it will eventually get to the point where they're completing homework outside of what they're learning in the classroom. And at that point, it becomes unreasonable because you have to question, what is the student actually learning? Like, are they being able to keep up doing homework outside of what we're teaching in class? And if what I'm teaching in class is ahead of what they're doing, they're going to be confused the whole time. It's not going to be beneficial for them. It's going to be more detrimental than helpful. So that's another example of, a reasonable accommodation. Now, there are special circumstances and situations when that accommodation may be granted. So if they do have an English class that is Monday through Friday, and depending on their diagnosis and the severity of it, that might be an accommodation that is wrote for them at that time. And we can change accommodations at any time. They would just have to contact me, sit down with me, meet with me. We look over what's going on. What are they struggling with? I would, if there's a particular situation, I would reach out to professors and get like their viewpoint on what's going on. What are they seeing? And then we can change the accommodations. I can send the letter out that day and it takes effect that day. Super easy. Another special accommodation, completion of work to be done online. This isn't real common, but I do see this especially with student athletes that experience injuries that are quite extensive. So if they're going to, we do have temporary accommodations, and temporary accommodations come into play when an individual experiences a disability that can be, or an injury, I should say, an injury that is going to last more than 6 months, which would then qualify them for temporary accommodations. So it would have to be documented by a provider. Like, I would have to have something documented in a way that shows this care is going to last more than 6 months. And typically we'll see that, if someone has, if they have an injury to their knee and they're going to have, surgery, hospital time, physical therapy, anything of that nature, that's typically when I see that. It's not real common. Another special accommodation would be like doing one-on-one accommodations for oral presentations and exams. This is typically done with students that might have a disability related to speech, might be related to PTSD, depending on where that stems from. And if it's something that works for the student and the professor, in a sense of, is it going to take a student to present twice as long as the rest of the class, and it's going to kind of not be harmful, but give negative attention to the student? Like, would it be more beneficial just to do that one-on-one? Then that accommodation may be recommended. Now, obviously, if it is a presentation or an exam that is following guidelines for license or like a state exam or something of that nature, then that accommodation cannot be offered. And then another special accommodation might be an aid in a classroom. Now, this is not an aide in the classroom in the sense like what you see in high school. This would be more so if someone, let me think here. Let me think. So if you have a student that maybe they don't have the use of their hands and they're in a lab, we could find someone to place in the lab with them to aid them what they're supposed to be doing, but they're not able to. And an aide could be another student in the classroom, or if we need to hire someone for a position, we can do that as well. And then I have two things listed here as uncommon accommodations. And I just mentioned this because this is something that comes up quite a bit in those initial meetings that I have with students, especially incoming freshmen. Uncommon accommodations includes that reduction in workload and modification to material. So like a reduction in workload, like 50%, like they don't have to do, like if there's 100 questions, they would only be required to do 50. That's not a common accommodation. I have not wrote an accommodation such as that since I've been in this position. And then a modification to material. So if say say they're supposed to take an exam and they have to answer 50 questions and they have to do like 5 short essay questions, like changing all of that is what the modification to material would be. The student is still going to be expected to complete all those questions and that short essay. They're just going to be given that extended time to do it. So that's where the common accommodation comes in. Now, it would be up to the professor. You know, if a professor wants to change those, they are welcome to. That is, you know, a decision that the professor is free to make. I would just suggest that they make it known to the student that that is something they are doing, that it's not an accommodation. And I say that because I have had situations where students have received, you know, those uncommon accommodations because the professor was like, hey, yep, don't worry about doing that. We're just going to do this. And the student gets used to that. And then the next semester starts and they have a new professor and they expect the same thing from that professor. But it's not an approved accommodation through our office. So, and there are several professors that, you know, they will communicate with the student. They can see in person, you know, what the student is struggling with, and they, you know, are willing to work with them, and they do make those, you know, different accommodations for them. And it helps the student, you know, learn and be able to participate and engage in the class. I think that's wonderful. I would just make sure that the student's aware that that's just an accommodation that they are willing to offer. So testing accommodations, this is, I think I already went through this. Oh, no, this is for testing accommodations. So the process for testing accommodations at Hatcher Hall. So that's where I'm located. And for a student to test here, all they have to do is talk with their professor and say, hey, I'm wanting to take my exam on this day. Is that okay? And the professor would be like, yep, that's fine. So then they would go online and schedule their testing day on it's calendly.com. And I have the link that I share with the students every semester, regardless if they get that accommodation or not. It's kind of part of the email that I send. They just click on the link, put it in the day and time that they want to schedule, and then they would come here to take their exam. So when a professor is told that a student is planning to test here, then they would either post the testing material and information on our Proctor platform that we use, or they can email it to me. Either one's fine. I don't care. I have some professors that will post it on the Proctor platform, and then I have some that will just email it. Some drop them off, they'll do, like they just come by the office and they just drop it off in a big envelope. And then there are some that will send them in our office, like through inter-office mail too, which is fine. And then I will, if it's emailed to me or if it's posted on the platform, then I will print it. I'll have everything ready for them when they come in to test. When they come in to test, that we have a set of lockers by the front door, and they have to put all of their belongings in the locker, and then they're provided a lock with the key, and they can lock it and they can hold on to the key, but they're not permitted to have anything with them except for a pencil, unless they are allowed to have notes, like if it's an open book exam and or they can use notes, then they can have their notes, or a calculator if they're allowed to use a calculator. Now I do have a couple students that have the accommodation that they can wear headphones during exams. And there is one student that I have allowed to listen to like white noise. And that was because the test lab was full. Like I try not to let any more than 4 students in the test lab at a time, because outside of that, you have to question, is that a distraction-free test environment? So it wasn't overbooked, but it was, there was 3 other people in the room, and one of them was on the computer, so there was clicking. And the student asked if they could listen to white noise on their phone, well, on their headphones that was streamed Bluetooth from their phone. And I said, yeah, but your phone has to stay with me. So I kept the phone with me where I could see, what it was they were listening to. And then they completed the exam in that manner. And then once the student completes their exam, I scan it and I can email it to the professor, or I can put it in an envelope and have it put at the front desk, and they can stop by the office and pick up a physical copy of the exam. Either one is fine. I have some professors that will do both, and I have some that prefer one over the other, but either one's fine. I do keep all exams for a full semester. Regardless of when they take it, I keep it that whole semester. And that's really all the slides that I have as far as accommodations go, testing accommodations. And if anyone has questions, feel free to ask away.
Melissa, do you have any questions you'd like to ask?
I don't have any questions. Thank you, Michelle.
Oh, you're welcome. Thanks for coming.
Thank you.
Well, I do have a couple of questions, if you don't mind, Michelle.
Yeah.
So you talked about temporary disability or temporary accommodations for injuries that are going to require at least 6 months of recovery time or treatment.
Yep.
Are there kind of specific things to do? Let's say you break your arm, maybe you're going to be in a cast for 6 weeks or 8 weeks, and you talked about like a lab situation or something like that. For more short-term experiences, is there kind of a formal process, or is that just kind of worked out between a student and a faculty member?
No, so they would go through the same process as someone applying for normal accommodations. We would need documentation from the provider stating, where the barrier is there with the disability or with the injury. And again, I would probably already be in talks with the professor, because that's why the situation has come up. But if I'm not, I can reach out to the professor and say, hey, I'm meeting with, the student. This is the issue that we have. What options do you think we have? Like, what are we looking at here? Because there might be something else that we might be able to do for the student without having to offer an aid. Like maybe they can do something on the computer with the one hand that's not injured, or maybe there's something in the lab that they can do that won't require the use of both hands, or whatever that might be. Now I know I have had a student in the past. They had a leg injury, and from my understanding, it was quite extensive, and they were non-weight bearing, and they lived on campus, so they weren't close to home, and so we had to write special accommodations that allow for the student to complete their classes online. These weren't classes that were typically online. But in order for this student to continue with classes, that was the only way they were able to do it. So I know if I remember correctly, there were some concerns from professors at the time about putting their class online. And it was kind of just like a, hey, reminder, like, remember when we were doing COVID? That's kind of what you're going back to with this situation. And I believe this student actually ended up having to leave and go home, and dropping out for the remainder of the semester because of the injury. And I think there was like they had to have a couple more surgeries or something like I said, it was quite extensive. So, but that's an example with a temporary accommodation. Now I know one accommodation that tends to come up, and people, I don't know if there's just that assumption there with it, but like pregnancy related. So being pregnant in itself is not an approved disability. Now, if they were to develop an issue as a result of the pregnancy, then that is something that we can look at. That is something that would, qualify them. Like, for example, if they were to become a diabetic, like a gestational diabetes, or if they develop a cardiac issue, something of that nature, that's the result of the pregnancy, that would qualify them. But just being pregnant, it does not qualify them. Same with nursing. Like if an individual has had a baby and they are nursing a child, that was something that came up recently, and that's not an approved disability that would allow someone to have an accommodation, because they were wanting to have special accommodations to leave class, be late, and possibly do a class online. That's what they were seeking, because they needed to be with their child to nurse them. So, I mean, we have places all over campus, like nursing stations, where students can go if they need to nurse. And I know of students that have people bring them their child. They go to the nursing stations. They'll go out to their car. They nurse the child. They go back to their what they have planned, and then they, the person that brought the baby goes back home with the baby. But so, I mean, there are options for them to to do that on campus if they need to, but it wouldn't be something that would qualify someone for an accommodation.
Okay. So you mentioned sometimes in that transition from high school to college, students maybe aren't aware that they need to contact your office to get their accommodation set here on campus, or maybe students just, in some cases, maybe they think, well, maybe I don't need accommodations anymore, or whatever.
Yep.
But so if you find yourself in a situation as a faculty member where a student is struggling and you're like halfway through the semester, let's say, and they haven't reached out to get specific accommodations kind of recorded, what are your options as a faculty member if you're already like halfway or 3/4 of the way through the semester and the student is struggling and still doesn't have documented accommodations?
So there's not a timeline to establish accommodations. Somebody could come to me the day before their final and say, I want to apply for accommodations. And I can say, okay, well, this is the process. This is what we can do. I can't guarantee that we'll have it done before tomorrow, obviously, because they have to be able to provide that documentation that would ultimately approve them, for accommodations. But if they're, I mean, I have students that don't renew their accommodations, and this is very common, and this might explain why. I don't know if there's questions on this. So I send out a whole lot of emails before the semester starts with all these letters to professors. Like they get bombarded by me. I'm sorry. And then the semester starts, and then they probably notice like all these letters trickling in. And that's because a student did not complete the renewal form like they were supposed to. And now the semester has started and they don't have their letter, and they're like, hey, I never got my letter. And I'm like, you didn't complete the renewal form. There's no way for me to know if you're planning to come or not. So that's how I know, is by you completing that form. They're like, oh, well, yeah, I just forgot. So then I can renew it at that time. They're just not getting it before classes start.
Okay.
So, and I will tell you this, when each semester starts, I typically end up running about a week behind. So like if they text me or if they contact me on, Tuesday and semester started on Monday and they're like, "Hey, I never got my accommodations. Can you send it?" And I can be like, "Yes, I can. I can renew that for you." And then I will send them the reminder about completing the renewal process. But I also remind them that I've received their request, but they should expect a delay in a response to that request, because that may not happen, for a couple days.
Okay.
So that's why I always stress to them, I'm like, renew, 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 renew. Like, do the renewal, then you don't have to worry about it. It literally takes like 5 minutes. I know you're on your phone anyways. Like,
Michelle,
just
I
I'm
have
sorry,
2
go ahead, Melissa.
questions
okay.
now. So the renewal, is that something that needs to be done every year,
Every semester.
every semester? Okay.
Mhm.
And then my other question is, if you have a student who gets double time, say on quizzes, and say you have one that's 20 minutes
hmm
and you then just double it across the board to 40 minutes, does that
Yes.
count? Or does
Yes.
that at that time make 40 minutes the standard and you'd have to double it for just that student in particular?
No. So if you're giving, like, say you're giving a quiz and it's a 20-minute quiz, like the class gets 20 minutes, then that student is going to get 40 minutes. That's it.
But if like if it were online, a 20-minute quiz, and then you just
Mhm.
made everyone's 40 minutes, does that count? Or does
No,
okay.
no,
I was asking
because
that because my son gets accommodations and one of his professors does that. And so,
mm-mm.
and it's not been an issue for my son, but I didn't know if something like that counts.
No, because here's what happens if and I know exactly what you're asking because this was a recent question from another professor. If a professor goes in and changes the time for the class, so the class is receiving 40 minutes for this exam. So I'm going to get 40 minutes to do this exam,
Hmm.
right? Okay, well, I don't have accommodations. Like, I'm getting 40 minutes to do this exam. So Sally sitting next to me has accommodations, or Sally's at home, whatever, since you said it's online.
Hmm.
She's getting 40 minutes to do the exam as well. Where's the accommodation there? Like, how
Right.
is that, I understand,
Yeah,
like,
it's
now the
on.
professor has changed the time, and the reason I think that happens is because it's easier for the professor to go in and just change the time for everyone on Blackboard than to have to
Right.
go in individually and change it. But that's
Right.
not really offering that accommodation. I mean, the exam might be slated to be a 20-minute exam, and now they're offering the professor's offering 40 minutes, but technically when you break it down, like,
That's become the baseline then.
right, yeah. Yeah, because, and I just had to explain this to another professor because I understand that that might be, very mundane to have to go in and like select the student and change the time
Right.
every single time. And there's a lot of students, like I mentioned, there's 100 and what did I say, 30 some, and that's just academic. That's not counting housing and other environmental accommodations. So there's a lot of students. But by doing that, then that professor is not offering that accommodation.
Okay. That makes sense.
So, I mean, I know in their mind they think that is because now they're just giving it to everybody. Like, hey, congratulations, because Sally, you guys all get 40. I mean, they shouldn't say that. Don't say that. But,
Yeah.
but I mean, I understand the mentality behind that, but someone could really push back against that.
Okay.
So I've got one more question for you, Michelle. So
Okay.
we talked about this a little bit before we started recording, but a lot of students have off-campus placements for teaching, for clinicals, things like
Mhm.
that. And I know, as you said before, it's complicated and situational. It depends on what's going on. But
Mhm.
so if you are a faculty member teaching in a program where you have students working in these clinical settings or teaching settings, things like that
Mhm.
off campus, what process would you suggest they go through to make sure their students are receiving the appropriate accommodations, to make sure they're not making any mistakes around disclosing disability in their students, that kind of thing?
So it's really the disclosure part is really important, and that really applies to all professors. So I mean, professors need to be aware that they have I want to say like strict guidelines that they have to follow as far as disclosure goes. So it's very important that a professor is not questioning a student on their disability. They're not putting a person in a place to make them feel as though they're being mistreated or treated differently because of this disability, especially like in the front of the class. And I mean, and that can happen in the sense of just comments like, hey, we're going to take an exam. Hey, you know, Sally, you need to go out in the hall. Like, there's different ways to go about doing that. And I do discuss that with the students when we have our meeting. You know, we talk about different ways to communicate with the professor and ways to go about handling different situations so that they're not kind of put out there in front of everybody. When it comes to like off-site accommodations, it's really going to depend on what that accommodation is. I know in the past when I've had to work with nursing, for example, and a student has had to have an accommodation that has allowed them to have more absences than what is typically allowed for the program. We still keep it very limited. I work closely with Dr. Bailey, and we work together. We sit, we talk about, is this going to work? Is this still, keeping the integrity of the program? Is this going to be beneficial for them? Is this going to allow them to learn and complete what they need to complete? And it's really a team effort. And so we can still offer the accommodation, like if the provider is stating that they need to have, additional absence days due to this, due to their disability or their diagnosis, we can still work together to come up with a plan on how that can be done while still upholding the integrity of the program. And I think that's the most important thing, because you don't want to offer an accommodation that's going to not in the moment hurt a student, but it's going to hurt them later on. So like when that student gets ready to take that state exam, like they're not prepared for it because those accommodations were in place. That completely defeats the purpose of the accommodations. They might pass the class. So like in their mind, they think, okay, yeah, I did good. This is great, but then when it comes time to take that state exam, for them to get their license, like they're not prepared. They're not playing, they don't have the education like they needed it. So I personally have found just working, communicating, with those program directors and coming up with plans that, really work best for that given situation.
Okay. So basically, if you find yourself in a situation where there could be some conflict, just reach out to you and figure
absolutely.
out each individual situation.
Yeah, and usually if I have a student come to me and they mention to me that they're like in a certain program, whether it's dental hygiene or it's nursing or it's education, like I'll immediately like reach out to them and say, hey, I'm working with a student. Can you give me some additional information as far as your guidelines go? So then I can start looking into like what might work, what might, what won't work. And then I can meet with the student again, or I can meet with staff, faculty, just in a way that we can really work together, really. But yeah, I have found that's really been the best thing, because it's really, really difficult to do like a across the board, oh, this is what we're going to do. Someone comes and says this is the plan. It's really difficult to do that, again, because each person's diagnosis affects them differently. So
all right, well, thank you so much, Michelle. I really appreciate all this information, and I will make sure we get this recording out to folks at the beginning of next week.
okay, sounds good. Thank you.
Thank you.
See ya.
See ya.